Welcome to the Healthcare CEO podcast. Join us as Daniel Fernandez, healthcare leader and patient experience advocate, leads dynamic one-on-one discussions with healthcare executives, consultants, and other industry experts. Listen in as they share actionable insights and unique perspectives into the day in the life of a healthcare CEO.
Hello, everyone, and welcome to the Healthcare CEO podcast. I'm your host, Daniel Fernandez, and with me today, very exciting guest. His name is Patrick Daly. He is the CEO of Sonus Home Healthcare, one of the largest and I would say one of the fastest growing home healthcare companies in the state of Florida. Welcome, Patrick.
Thank you so much, Daniel. Pleasure to be here.
So the reason why you're one of my favorite guests is that we sort of joke about needing sometimes to have a crystal ball to sort of see into the future. But I feel like you have a working version of a crystal ball because all of your predictions are always like spot on. And clearly it's worked because you guys are growing so fast.
I appreciate the compliment, but I can assure you there's some maybe some cracks in that crystal ball.
And we'll talk more about that, of course. Before we get started, I'm going to kick off with your bio. So for those listeners out there, Patrick is the CEO of Sonus Home Healthcare. His extensive experience in management, sales, marketing, and operations, combined with 15 years in the home healthcare industry, have helped him grow the organization to a brand singularly focused on defining how home healthcare should be done in the technology age. And of course, we'll talk more about the technology aspect in a little bit. In his role, Patrick is responsible for the company's vision and growth strategies, including vital planning and business integration, business and sales development, risk identification and mitigation, and budget management. His clear direction and supervision of programs and projects drive the organization's sustainability. Let's talk a little bit about where you're from. And I don't necessarily mean Bayada, because it sounds like you're from the Bayada home healthcare network as well, but you're from a town called Reading, Pennsylvania. Is that correct?
It's actually pronounced Reading.
Reading.
So, well, yes. Well, it phonetically it looks like Reading. It's pronounced Reading, but yeah.
It does. So
Reading,
I'll tell you what I know and what I've learned. It's a small town of 88,000 people. It is one of the 4 railroads on Monopoly. I did not know that.
Yes. Yep. We are on the board, if you will. Yep.
So is it safe to assume that everybody in Reading plays Monopoly, or you've played Monopoly at...
I think growing up, it was a staple in the household, for sure. For sure.
Nice. And here's another little tidbit about Reading. It is also known as the Pretzel City. So I have no context to that. What does that even mean?
There is a large number of national, probably international manufacturers of pretzels in the city of Reading. So not, your hard pretzels is really what they're mostly known for. Is not your typical soft pretzel that they associate with Philadelphia, but the hard baked soft or hard baked pretzel is really prominent in the area.
Nice.
Yeah, and they're good. I mean, they really are.
They are. I'll have to check it out next time I'm in Pennsylvania.
My mom used to have to ship them to me when I was in college. So.
Oh, really? Yeah. So I would love to know the story about how you've gone from Reading, Pennsylvania to becoming one of the leaders in the home health industry. What does that look like for Patrick?
All right. So from Reading to Florida, it's a long journey. And certainly I wouldn't call it linear in any aspect of the way, but I ended up going to college in Savannah, Georgia. I had a baseball academic scholarship. So I competed at a Division II level for 4 years. I caught my first 3 years in college, so I was a catcher. And then my last year, they stuck me on the mound, and I ended up pitching my last year. So I couldn't really ever figure out how to hit a curveball. So they were like, "You got a really good arm, and if you wanted to maybe continue playing at the professional level, this is really your best chance." So yeah, it was fun. So that's how I got into the Southeast. Yeah. And then shortly after college, graduated with an English degree and still thought I was going to play baseball the rest of my life, and realized I wasn't that good. So I was like, all right, now I have to work. I think my first job after I graduated college, I was driving a forklift at a Home Depot warehouse. Savannah was a really large industrial shipping, port, and they had a warehouse, and I was, moving along in a forklift with a college degree, trying to figure out what I was going to do for the rest of my life. And, somehow, luckily, I stumbled upon home health care. So I started in home health care in Savannah, Georgia, and then moved to Florida with the company I was with then. It was another national home care company specializing in mostly pediatric home health care, and spent about 5 years there. And that's how I moved down to Florida. And, have spent the last, 15 years predominantly in home health care with some, intermittent entrepreneurial ventures as well.
Well, yeah. Well, whatever you've done, it's worked, because you definitely have one of the fastest growing companies, and that's got to be exciting.
Yeah, it's extremely exciting, and it's, at the same time just as rewarding to be able to lead a company into, not just a high growth mode, but a highly rewarding career too. So.
Yeah, and I want to talk a little bit more about that. I've got a little excerpt from Sonus that I'll read, and then we'll kind of go from there.
All right.
Sonus, their mission is to bring love, light, and laughter into the homes and communities they serve. They do this with a long-term vision of how they define a community. They're also vastly different, so they find people who embrace their local communities, become active in supporting their diversity, and built a platform as a corporation that reduces the burden of some of the day-to-day operations, which as a home care agency, they have to adhere to. So their focus is solely on delivering high levels of patient satisfaction, caregiver satisfaction, retention, and delivering quality care consistently to the lives they can make a difference in. Beautiful, beautifully written.
Thank you.
Now, a lot of people say they're amazing at all of these things. I'm just going to kind of throw that out there, right? So if we ask people what they're great at, they're like, we're the best at quality of care, right? But how do you know this to be true? Are there any sort of like measurements that you've used, or have you gone about measuring your success in this space?
Sure. Yeah, no, it's a great question. I think everybody shows up to work every day, and, we all think we're doing a great job. But sometimes it's hard to validate that. So as an organization, has gone through exceptional growth in a short period of time. We wanted to make sure that we were living up to our mission, and really, ensuring that if we are saying, we're taking exceptional care in the communities we serve, the best way to find that out is to ask really your constituents. So towards the end of last year, we hired a third-party agency to conduct interviews with, our referral sources, the hospitals we work with, the physicians, the case managers, the health plans, discharge planners, and, we allowed them the opportunity to say, what, we think we're really great. Numbers may tell us that, the amount of patients we're taking on would tell us that, the number of employees we're hiring would tell us that, but, is it true? And, fortunately, we gathered that feedback, and, I think our overall net promoter score as a result of that survey was, an 85. So,
Wow.
in terms of the industry, our referral sources and the people we work with every day are really the ones that, validated that. So yeah, it felt good. You certainly don't know what the outcome of that's going to be when you initiate something like this. And, you're certainly, wondering what the results are as it's happening. But yeah, we have validated at this point, and, we feel good about, not just what we've done, but where we're going to.
That's amazing. I feel like more organizations should follow that lead. What did that process look like? I mean, did you just kind of Google someone to help you, or how did that happen? And then what happened after the first point of contact, or any, tips?
Yeah, it was a nationally renowned firm that specializes in justice. Okay. And, we gave them our referral contacts. We gave them, all the contact information, and they initiated the calls themselves and all the communication, and then gathered the feedback, and then benchmarked us against, other like competitors in the space too.
Nice.
Yeah, and we did the same thing with our caregivers too. So that was, another, point of potential concern, or an area which, when you are growing this fast, are you delivering consistent enough services to the employee base? And, the feedback we got from our employees, the variation between the net promoter score of our employee base and the other competitions was over 60 points. So yeah, so overall, not just our referral sources were happy, but, the employee base as well.
That's amazing. I mean, there's always what the organization believes to be true, and then there's what your team members and your caregivers believe to be true, and sometimes they're not the same. So I think that going through that process was obviously enlightening and important. So
Yes.
yeah.
It was certainly reassuring to know that who we are saying we are on the outside is represented within the walls too.
That's beautiful. And in terms of using technology, I mean, we've talked about how quickly you've grown. What are some of the ways maybe that you've leveraged some technology to help with that growth?
Yeah, so we've gone through multiple iterations of technology investments in the 3 years since I've been here. Prior to my arrival, the individuals were working in a remote desktop environment where they were logging into a server somewhere out in Colorado. There was bandwidth issues. We had multiple phone vendors, and granted, this was a multiple legacy companies that were rolled up into one. So we had, different databases that we were utilizing. We had different electronic health records we were utilizing. So, when we set forth the vision of the company 3 years ago and said we wanted to be, the leader of how home healthcare was going to be delivered in a technology world, we realized we needed to make significant investments in our infrastructure. So first step was, how do we get from a remote desktop environment to the cloud? While that seems to be just maybe a simple step, the application of that is certainly, a challenge. When you have, a dozen locations across the state of Florida, you've got over 100 administrative users that were accustomed to working one way, to say, okay, today it looks one way and tomorrow it's gonna look entirely different. So, that was step one of the process. Step two of the process is we knew we needed an electronic health record that was going to take, what historically was documented on a piece of paper at the caregiver level and say, okay, well, there's a lot of variation in terms of, the scalability and success rate of that model when you may not know what's happening in people's homes on a day-to-day basis. So we implemented a software over the last 18 months that each individual caregiver, it's cloud-based obviously, but each individual caregiver can document what they're doing, where they're doing it, conditions of each patient in real time. So that's it's an application on their phone that they can, clock in, clock out with. It's utilized for a payroll record, all the way through to, ensuring that the nurse is, where they're supposed to be, when they're supposed to be. So it's got geofencing capabilities. So we know, is that caregiver really showing up to support that client? And then from there, are they doing what it is the doctor ordered? So we have, a cloud-based system now that supports all of that in a very seamless way. And, in addition to that, we've made investments, from a strategic standpoint on the hiring process. Right. So while, we may have brick and mortar in multiple locations and cities throughout Florida, sometimes a caregiver could be, and a client could be 120, 150 miles away from where we have an actual place for them to go. So we've digitized the entire application process, the onboarding process, the training process, so that, we can have a caregiver essentially from our living room sign up to come work for us, go through the application steps, go through the background screenings, go through the competency tests. And then we've also invested in, a learning management system so that, when we need a particular nurse with a particular skill set, right, we can match that and validate that they have the actual skills to be able to perform, a certain task. So, and that's available to them on demand. It's online. So if, they have a base minimum requirement to be able to come work with a specific client, but at the same time, if they want to advance their skill set in any degree, we offer that as an additional service to our employee base. So, in a short amount of time, we've made, a lot of headway in terms of taking what was historically a business run 25 years on a piece of paper with a lot of people doing a lot of different things, a lot of different ways, and not necessarily any real, points of emphasis on quality, to be able to create a tight system of control so that, while we talk about how diverse each one of our communities we serve are, the right people in those local markets are really focused on the caregiver and the client relationship, while we try to take a lot of the burden of running a home care, healthcare services business, on the back end off of them. So
I definitely want to talk more about technology, but back to the topic of caregivers. So it seems like every day you log into the internet and you're like checking all the news outlets, you hear about unemployment rates and large companies furloughing, tons of team members. How have you guys been doing there from a staffing perspective?
Yeah, so from a staffing perspective, we still don't have enough.
Wow.
We are, hiring, probably 30 to 40 nurses every month at this point.
Okay.
We've hired administrative staff over the last 6 months, and even though we're all continuing to work remotely, with some, minor hiccups, from an IT standpoint here and there, but for the most part, we've been able to sustain our operations and still try to attract, talent to come into the company at the same time. So fortunately, while I recognize a ton of other companies are making really, really difficult decisions with their employee base, from a caregiver standpoint, we've grown, and even from an administrative personnel standpoint, we've continued to add more employees. And I think the challenge is, their experience now is entirely different, right? Before they would travel to our corporate office, we'd have a consistent and routine orientation process. So they got to, not just learn about, the company's mission and our culture, but also, experience the people that they were going to get to meet on a regular and routine basis too. That's gone now. So we're certainly learning as we go, but from a business standpoint, it's certainly nice to lead from a position where we're still offering, opportunities out there to people that are going to be a good fit for this organization for the future.
Wow. And if anybody's listening, they're watching this on YouTube, feel free to drop a comment below on maybe some tips or tricks or something to help Patrick, gain more quality caregivers, which I'm sure you always appreciate that feedback or those tips.
Absolutely.
Yeah. And while they're there, maybe subscribe to our awesome podcast as well.
Yes.
Now, back to the technology aspect. I recently just went to a GI doctor, and I was given a stack of papers, and it had a pencil and a pen. And halfway through the stack of papers, it said to switch to a pencil. And I thought to myself, this is like something out of the 80s. I don't even understand what's happening here, right? And then I think to what's happening today, where we've seen the incorporation of like telehealth, telemedicine, and all these technologies that are being introduced that we're becoming accustomed to now. And I think of how that practice is probably struggling, but you've been leveraging technology solutions for years. So do you feel like maybe because you started early on adopting all this technology, it's helped kind of to weather this storm where all of a sudden practices around the world really are having to adapt very quickly?
Yeah, absolutely. I think we're fortunate to be ahead of the curve at this point. It's to potentially go through a cloud migration so people could work from home at this point would be disastrous. So if you look at the accelerant that the pandemic has created on, an archaic system, if you will, I think in a lot of ways it's going to be a positive outcome ultimately for the consumer. It's not like the technology didn't exist. I'm sure your GI doctor had an opportunity to switch to an electronic health record at some point over the last decade.
Right.
But now they're probably forced to figure out a pivot. How are they going to now implement telehealth themselves? When people aren't going to want to go to the doctor for a regular and routine checkup because of personal fear of their own safety. I would not want to be that practice that's, having to implement something new, while just trying to lead through a time of such uncertainty too.
Wow. And maybe you might not have seen as much of this because you're so far ahead of the curve on the technology aspect, but have there been any changes in expectations from either caregivers or patients during this whole sort of global pandemic? Have you seen anything that has maybe caused you to adapt or shift?
Yeah, I think
Yeah.
the sensitivity around, the home environment and personal safety has really, risen to a level which you have a responsibility to each one of the families we serve. And, whether we see that, client maybe for just a day or two a week, or within their home environment for 24 hours a day, 7 days a week, the responsibility doesn't change. And, the work that we've done proactively to, secure, protective equipment for the caregivers, the rapid response that we had in a short period of time, I really couldn't have been more proud by leading a company with such caring and compassionate and empathetic people that just want to do the right thing to promote safety during this time. And it's really been remarkable. The testimonials I've received, the stories from families and the response, and, they're absolutely scared too, right? So, we have had some families that, if one of their regular and routine nurses is unable to fill a shift, they're asking us maybe not to send somebody out. And, we have to respect that because, we don't know where maybe somebody has been. And, it's such a dynamic and fluid environment to lead through. It's just, you just want to do the right thing for the other person that you're taking care of right now. And,
yeah,
most of the time we get it right, but it's obviously not perfect.
Yeah, that's very true. So home healthcare in the future, let's say you whip out your crystal ball today because it seems to be accurate. What does it look like? What does it look like now, and how is it evolving? And, what do you foresee it looking like in the future?
Yeah, I think in a short period of time, we've seen the immediate impact, especially around telemedicine. And, if you look at that technology that's, been held up in bureaucratic, nonsense for the last decade, because, one side sees the value, the other side sees a reduction in, their billable visits. The focus, I think in the future is going to be, how do we take care of a consumer in the environment where they feel safe? And given the pandemic, I don't know, if anybody really wants to be in a hospital right now, or be in a senior living facility, or be in a nursing home. And I think families are really rethinking, where do I want my loved one to be when they need care? For the first, the first part of that, to answer, the question of the crystal ball, is I foresee the demand increasing, right? The second tier to that is, now that we understand that this is probably where people want to be, how do we help incentivize organizations to be able to deliver this care? And when will the funding align with where people want to be? And, I think at some point, like you're seeing with telemedicine, some of the red tape around that, was really around funding. Who's going to pay for it, and how are people going to continue to ensure that they have, a practice that is sustainable. So I would like to think, if I had a crystal ball, is, if you look at the extraordinary costs and the burden that are, on the healthcare system as a whole, and you look at one of the most cost-effective ways to deliver it and keep people safe for a variety of needs, right. How can we as an industry advocate for, fair reimbursement, so that, maybe we can help prevent an acute event, right? And we can, really get ahead of, you hear a lot about social determinants of health and, value-based care that really hasn't, it hasn't taken effect in our industry yet. But I think this push to move rapidly to keep people safe at home, ultimately has to be supported by, the funding and the resources, so that we can pay individuals a fair wage to be able to ensure that consistency is delivered. And, I'm always looking for how we can do that in a more efficient and a better way. And, how do we demonstrate value, whether it's, the health plans we work with or the family member that's receiving the care, what are there other services people need? Are there additional areas of risk that we can help identify way before somebody gets sick, which is really where the cost and the burden comes from. So if we put more money into well-being and healthy living, would there be such a systemic financial impact on healthcare? And in an ideal world, I would like to think that an industry like ours could help demonstrate that value in the long-term picture.
Got it. Now I'm going to tell you what's in my crystal ball, because I also have a prediction as well. So we believe that in the wake of COVID-19, there's going to be this potential gold rush of growth through acquisitions. And as a CEO of an organization that has grown through acquisitions, most people probably wouldn't know this, but you started off as several companies and then merged into one called Sonus Home Health. What do you foresee? Do you foresee that being a thing in the future?
Yeah, absolutely. I think if you look across, we'll just talk specifically about home care.
Okay.
It is an extraordinarily fragmented industry with, the largest 3 organizations in the US may make up collectively about 5% of the market share.
Wow, that's small.
So there are thousands of providers that, are in each individual community, and they provide their community an exceptional service, and they have for, many years. But like my example of your, GI doctor who didn't, maybe get ahead of some of this curve, I believe there's going to be many other providers out there in the home care space that are in a similar type situation. So I think from a fortunate position for us, we have obtained enough scale to be able to, maybe look at some of those opportunities to say, owner, small business owner, are you still, wanting to continue to do this in this way, or is it just a conversation of, how do we help you potentially exit and still keep the level of continuity in the local community you served? And, ultimately, I think it's a significant part of our growth plan is to have those conversations.
Wow. What advice would you give to maybe the owner or CEO of a practice that's looking to maybe sell? Maybe they're just, looking to tap out or looking for some help with some of the pieces that they're maybe not as strong at. So an acquisition makes sense for them. What advice would you give them?
That's a great question. In evaluating, conversations like this that we've had in the past and other acquisitions that we've already tucked into the organization, I think there's a level of vulnerability and transparency, and sometimes it may be a hard pill to swallow when you have, a significant staff, for example, and you want to take care of them. I feel we have a very thoughtful approach and methodology to our acquisition strategy. Not every, business is for us. We have those conversations long in advance of signing a stock purchase agreement, if you will, because we want to know who it is that they represented in their community. And I think the more vulnerable you can be as a leader and try your hardest to cut some of the emotional ties away from, the potential, downside of losing what it is you've maybe grown organically over decades, that how healthcare is going to be run in the future is probably different than how you did it, for 25, 30 years, potentially.
Wow, I agree.
So, embrace as much as you can the change. But, I would ask, the owners just to be transparent and vulnerable with the information so that we can really make an assessment around fit too, right? We want to make sure that, we maintain our culture as we continue to grow, and that's priority number one. And, that means not every business is really going to be right for us. So, the more we get to have an intimate relationship with an owner prior to signing a deal is really beneficial for, the long-term employees that may retain, maybe retained with the business.
Yeah. One of the most humbling things that's happened to me recently is that Lauren and I, she's CEO of our company, we had a conversation with the agency owner of a $50 million agency. And we asked him because we were just sort of unsure with how the world and everything was sort of playing out. And we said to ourselves, do you feel that pressure, or is it just us? And he said, even though I run a $50 million company, I'm dealing with the exact same things as you. I have my leadership team coming to me as a CEO and asking questions that I don't have the answer to yet because it's just ever changing. Do you feel that? I mean, it's often said that the CEO position can be a lonely role. I mean,
I would agree with that statement. And I think, now more than ever, it's certainly been battle tested. We share in all of those moments of uncertainty right now. And, I think from an organization, yes, we've been resilient. Yes, we've been agile. I think, yes, we've been able to, continue to grow throughout such an uncertain environment. But I think deeply rooted in that is, we're very proactive in talking to our employee base that, we don't have all the answers right now, and there is no playbook for this. No. And to go back to, a little bit of the vulnerability piece from, the acquisition side, the same holds true for us, right? And I think the more honest and the more frequent we can communicate with all of our staff, the more reassured they feel. And, sometimes it's just simple as, getting on a Zoom call and asking people how they're doing, and I think, now more than ever, it's, you used to get bent out of shape when somebody arrived at 8:05 or 8:15 and they were 15 minutes late, right? You may even counsel or document that employee for not doing the right thing. But I think, the right thing right now is really just be there for people and take care of each other and yourself. And, I think from a leadership and management team, I've got an exceptional group of people that, certainly have really helped all of us to rise up to the occasion right now. So while it feels lonely, if you rely enough on your support and kind of recognize, nobody has all the answers right now, and it's okay to admit it probably. And the sooner you probably reconcile with that, the better off you are when you're leading a group of 2,000 employees.
Right. Whenever I see you, you look calm, cool, and collective. And people have said that about me as well. And they ask what the secret is. I used to joke and just say Tito's, but in reality, I just think a lot. It's kind of like my free therapy. What are you doing to keep sane? I mean, I feel like I call it the Richard Branson effect because everybody always sees Richard Branson. He's out there like kite surfing and doing all of these epic things, right? But the guy's working like insane number of hours and behind the scenes. People just don't always see that aspect of it, So what are you doing to keep sane?
Yeah, it's a great question. While the exterior may look a little calm and collected, there's certainly, enough turmoil every day and, another new situation that you've never dealt with to kind of reconcile. But I prior to this, I was a frequent member at the gym. But that's off the table right now. So I knocked some dust off a road bike that I had, and that's really been probably my number one outlet in terms of therapy. Is I'll just get on the bike and ride 25, 30 miles down the beach and just kind of take in the beauty that's in the world, and maybe stay off Fox News and CNN for a little bit, and recognize that it's not all that bad. It's still a beautiful place to live, and it's got a certain calming effect for me, for sure.
Got it. In closing, this is really a show by CEOs for CEOs. Is there anything you would tell other CEOs out there? Maybe some of your favorite tools, tips, tricks, things that help you get through the day, anything like that you'd like to share?
Yeah, I think from my perspective, our roles as CEOs is so much about consistency and communication. Mm-hmm. And, being a vocal leader to a group of employees at this point where you may not be able to physically touch and get in front of on a regular basis, really throws a wrench into a lot of what it is we do. So, trying to come up with, creative ways to continue to keep a group of employees engaged is really, probably the best first step right now as a leader of people. And, going back to a little bit of what it is I alluded to earlier is, take the burden off yourself of expecting to have all the answers. And, nobody really does right now. And, I think the further you get to accepting that, the better off your organization will be, and your employees will reap the rewards of that as well.
Got it. Well, with that, I'm going to close for today. I want to thank you for having you. Thanks for having me out. Thanks for having you on the show. Thank you for listening to the Healthcare CEO podcast. And be sure to catch our next show where we interview other industry-leading healthcare CEOs and executives as they look to shape the future of healthcare.